Welcome to the Holistic Psychiatrist Podcast, a place for inspiration, insight, and information on holistic mental health. Join your host, Dr. Alice Lee, and discover critical information on safe, effective psychiatric medication withdrawal. Explore new ideas that enlighten and expand the mind with cutting-edge authors and experts, along with former patients as they share their miraculous healing journeys. It's time to build your well-being from the thought up. It's time for the Holistic Psychiatrist Podcast. Here's your host, Dr. Alice Lee.
Hello and welcome to the Holistic Psychiatrist Podcast, where we are building well-being from the thought up. I'm your host, Dr. Alice Lee, the Holistic Psychiatrist practicing in Salt Lake City, Utah. Today, I want to share some basic, helpful, essential information on a phenomenon called protracted withdrawal. For more information about me and my holistic practice, please check out my website, holisticspsychiatrist.com. You'll find my podcast on protracted withdrawal on my website under the podcast section. And also an article on my website on this will also be available under holistic articles. Thank you so much for listening today. I'm really glad that you're here to join me. I wanted to share with you today what my understanding of protracted withdrawal is and how it's different from a regular withdrawal that's done properly. In the past, I did not want to work with people who suffered from protracted withdrawal because I felt that my skill level was not sufficient to meet their needs. But more recently, I decided to take on cases where patients have had horrible withdrawal symptoms for years. I found no one to turn to for a way to resolve their suffering. Given my integration of functional medicine, energy medicine, and psychiatry, I thought of all the people out there, I should be one of those that for what help I can offer. Meaning that there are a lot of people who may not be able to handle protracted withdrawal because they haven't had thousands of cases, but it's still important to try and help these individuals because they're suffering so much. So as I've worked with people with protracted withdrawal, I've learned a few essential, meaningful things about this process. Today, I wanted to share this with you. And let's start with the basics. So what is the definition of protracted withdrawal? From my perspective, protracted withdrawal is prolonged negative withdrawal symptoms that exist long after the medication has been totally withdrawn or stopped from the person. The question then is, why do some people do so poorly on psychiatric medications that they have to stop the medication even though they feel horrible and they can't go back on the medication and they can't be on the medication? So they finally throw up their hands and just stop taking it and just suffer through life with horrible symptoms. There's a few answers to that question. The first one might be that we're looking at a group of patients who's genetically suffering from problems with detoxification. If genetically you can't methylate very well, and of course you can take nowadays genetic tests like 23andMe and then just find out all the detoxification problems that you may have or your loved one may have. And you will be able to find that there are very common problems where people can't detoxify their medications. So that's one reason. A second reason might be that they've been on a medication for a long time and the immune system has become confused as to what is the innate neurotransmitter system and what is the medication that is bound to that receptor or reuptake pump. If the immune system, which rightfully should be alert and aware of foreign substances, start to confuse and start to attack how a medication is bound to, let's say, a receptor, over time, the immune system can become hypersensitized to the person's own innate neurotransmitter system and to the medication that has triggered that immune reaction. For people in that situation, it's very difficult for them to lower the medication because they still need the medication. When they lower the medication, the inflammation from the immune system will go down. So for a moment, a very short amount of time, they may feel better when the medication is lowered. But then they experience withdrawal symptoms. So then they might want to go up on the medication a little bit because they don't have sufficient neurotransmitters to make things work. As they go up on the medication, the inflammation goes up, and so they feel worse. If the immune system is now hypersensitized to the person's own neurotransmitter system, even if you add natural interventions that build natural neurotransmitters in the body, as those neurotransmitters go up to regular dosages, the immune system will attack those neurotransmitters, the reuptake pump and the receptors, and cause more inflammation. So you can't really win one way or the other. The only way that you can treat such a problem is if you have a tool that can change how information is carried out through the body. And that is the perfect venue for healing using the energy medicine techniques. So with energy medicine, we're starting at information and energy levels, information and energy that guide the body like a blueprint. And by changing that information and energy, there's a possible way that we can mitigate inflammation caused by a confused, hypersensitized immune system that thinks not only the medication is a foreign substance, but the innate neurotransmitter system is a toxin as well, or a foreign substance. So when people are in these types of situations, they become stuck between a rock and a hard place. They can't go up on the medications. If they go down, they have withdrawals. They can't even take natural interventions that help them build neurotransmitters, because as their neurotransmitters go up, the immune system will cause inflammation and oxidative stress for them as well. What do? You have to look outside of the typical toolbox that a psychiatrist is given, which is psychiatric medications to address these issues. How is protracted withdrawal different from a properly handled withdrawal process? The way I think of it, it's analogous to having bacterial sepsis. Let's say you got a bacterial infection. It's now spread out throughout your bloodstream, and you get into the hospital and the doctor treats you with an antibiotic in an effort to get rid of the bacterial infection. So a proper withdrawal is when they use the right antibiotic at the right dosage for the right duration of time, and the person is rid of the underlying problem. Their body starts to recover because they're not under a lot of stress anymore. They're resting. They get plenty of nutrients and hydration. The hospital is really like giving that person all sorts of support. And once they come out of the hospital, the ordeal is over. A person like that has gone through a proper withdrawal process. Unfortunately, the patients who are suffering the most from protracted withdrawal are those who are like the patients with bacterial sepsis, who go into the hospital, and unfortunately, there's no medication that is given to them that's a good fit, or the dosage is insufficient, or the duration is inappropriate. But then they're discharged from the hospital and they feel awful because their bacterial sepsis is only 20% relieved, and the 80% that's still going on is creating ongoing damage and stress to the body. So that's protracted withdrawal. So when a person goes out into the world and they try to function, they're not going to feel good enough to function as they normally would because the underlying problems are not addressed. A person like that, you can imagine if a person has bacterial sepsis that's only 20% addressed, what will happen after 3 years of bacterial sepsis? You get a lot of damage, not only like how you would experience in the beginning with inflammation and oxidative stress and horrible symptoms, but you can have parts of your body like out of commission, too sick to operate, There's all sorts of different problems that can happen for serious problems that have gone on for a long time. Now, it's hard for people to imagine that happening with psychiatric medication withdrawal. I'm going to give you an example of withdrawal from an SSRI. I don't know if you know this, but 95% of the serotonin neurotransmitter system is actually located in the GI system, the gastrointestinal tract. So with the GI system, if you lower an SSRI, Prozac, Celexa, any number of medications under that big umbrella, what will happen is that your neurotransmitter system that is heavily governing the GI system is not going to be sufficient to cause the GI system to function normally. Without serotonin to operate and give messages to the GI system, the function of the GI system will decrease. And when that happens, there are ramifications because you will suffer from gastrointestinal problems. And if the GI system is not properly digesting, delivering nutrients to the rest of the body, there will be long-term consequences from that. So a protracted withdrawal with even a simple medication like an SSRI is going to result in profound changes and debility to the rest of the body after a year or two of that process. It's like only eating 20% of your food that you've swallowed, like only 20% can go into the rest of the body to help with life. If that's the case, the rest of the body after 2 or 3 years will suffer greatly. So protracted withdrawal is different from regular withdrawal because with regular withdrawal, there's no, if it's done properly, there's no deficiency in the functioning of the GI system. In fact, the whole body is being supported in terms of the serotonin system in every way possible so that the only thing that you're doing is lowering the medication when the person no longer needs that dosage to facilitate functioning. So in the end, a proper withdrawal doesn't lead to global deficiencies. A proper withdrawal leads to wellness. A proper withdrawal leads to function during the withdrawal process. You should not be debilitated during withdrawal process. If you are debilitated during the withdrawal process, the withdrawal is being done poorly. And your body is telling you and sending you signals that you're not ready for that withdrawal. How does protracted withdrawal happen? Let me reiterate. Number one, insufficient support from the body's dependency on the medication. Number two, insufficient healing from underlying issues. And the third reason would be debility that is not properly addressed over a long period of time that results in metabolic and organ dysfunction. Some of them can be permanent. So it's not the same as a proper withdrawal. Protracted withdrawal, during that whole period when the withdrawal is not done properly, things can die and they may not be restored to the body. So let's talk about protracted withdrawal from an SSRI. I made a list of things that can easily happen during that very long period of time. The SSRI is not withdrawn properly. You can have low serotonin levels. You can have ongoing hypersensitivity reactions to the serotonin system that becomes worse over time because you're always going to have that serotonin system in your body. So the immune system will constantly be encountering what the immune system considers to be an antigen or a foreign substance. That's what the autoimmune problem means, is that the immune system thinks that parts of your body is a foreign substance. Protracted withdrawal from SSRIs have consequences to other systems due to poor GI function and nutrition. It can have long-term consequences to other systems due to inadequate sleep because serotonin gets converted to melatonin, and prolonged stress and resulting dysfunction to many of the systems throughout the body because it has a kind of a broad ripple effect. How to prevent or heal from protracted withdrawal? The best approach would be to provide proper withdrawal the first time. A lot of people, for most psychiatrists, I don't think withdrawal is even properly recognized as part of the withdrawal process because it's minimized by pharmaceutical companies. So the proper withdrawal really should be done by someone who has some additional tools in their toolbox, because not everything can be done by lowering the medication slowly. Number two is to go back to a higher dose if the withdrawal symptoms occur. So if you do have withdrawal symptoms, it means that your body's not prepared to withdraw from that medication. You need to go up on that dosage if you're someone who had done well on that medication, and not challenge your body to handle withdrawal when you're not ready. For the group of patients who can't handle any medications, low or high, who can't handle natural interventions that help them build and support the neurotransmitters, they are in a different category that's very difficult for them. But for those who did well on the medication and then they lower the medication and end up with withdrawal symptoms, my best advice is go back to the dosage where withdrawal symptoms are addressed and they don't occur. That means that your body is in a state of balance. And then look for someone who can help you with withdrawal by healing underlying causes, building neurotransmitters, and helping you withdraw at the right pace. The third way is, this has more to do with protracted withdrawal and withdrawal, is to provide proper nutritional and glandular support. Like I said, a lot of these individuals who have problems with medications in general have genetic problems with detoxification that respond quite well to certain types of B vitamins. And finally, I always like to throw in the advantages of knowing energy medicine techniques. You can find a lot of these good energy medicine techniques under my information tab on my website. You go to information, go to energy medicine techniques, and there's a whole list of them. My favorite is Empower Energy Technique, or EET. There's also energy breaths and story form, things like that, that I've created from my experience with energy medicine, and I call it Infinite Intention Technique. So Infinite Intention Technique has 3 levels of difficulty. The first 2 is pretty straightforward. Number 1, energy breaths, which you can listen to as a recording from my website. And number 2 is Empower Energy Technique, or EET, which doesn't require any skills with tapping, but it's just a scripted phrase, and it has been very helpful for my patients. So when you use energy medicine techniques, it addresses things at the energy and information level, but it also has a ripple effect, because everything is made out of energy. So when you heal the energy and information of the body, there are positive reproduction, there are positive ripple effects that eventually help you at the physical level as well. So what are some of the typical problems I've encountered in patients with protracted withdrawal? One is they continue to have underlying problems that got them sick in the first place. These are individuals who may have had multiple infections, problems with detoxifications, and accumulated toxins. Of course, functional doctors who don't know energy medicine can treat them with functional methods. But for me, it's been really helpful to learn energy medicine techniques to deal with infections and toxins and help with genetic problems. Number 2 is genetic issues. You want to heal the problems with methylation through the proper B vitamins. There are a few really important B vitamins that I found to be helpful for people in protracted withdrawal. Number 1 is niacinamide. I know that Abram Hoffer, pioneer in orthomolecular psychiatry, chooses niacin, but in my energy testing, niacinamide, actually, which is another form of B3, has been actually the B3 form that seems to be most helpful. The second is a form of B6 that is activated called pyridoxal 5-phosphate. Pyridoxal 5-phosphate is often abbreviated P5P. This activated form of B6 is oftentimes the enzymatic step that a lot of my patients have difficulty doing. They can't go from B6 to pyridoxal 5-phosphate because enzymatically they're lacking that genetic ability to do so normally. And so using P5P or pyridoxal 5-phosphate is very important for them. Methylfolate, that's an activated form of folate. So folate you can find in food, methylfolate. However, must be enzymatically created in the body. So you can buy them very cheaply in a bottle nowadays. Hopefully you can find good supplement companies that will create these great interventions for people. Methylfolate is another important B vitamin that I find very relevant. And the third one is methyl B12, which is an activated form of B12. And another thing that I found helpful is intrinsic factors. So there's some supplements that combine intrinsic factor with folate and B12 in their right activated forms. And that can be also helpful for absorption for folate and B12. There are certain supplements called, for example, in B12 and folate, which sometimes are very helpful to use for methylation. There are other problems that often occur in patients with protracted withdrawal. They have poor GI function. So nutritionally, they're in a bad state, and the GI system or gastrointestinal system is one of the organ systems that use a lot of nutrients to help keep up its function and its integrity. So by the time I see them, it's not just throwing a lot of supplements at this patient because their GI system is struggling so much with leaky gut and absorption and digestion. And oftentimes they may have an overwhelming problem with candida and the raw flora and microbiome in their GI system. A lot of patients with protracted withdrawal have prolonged insomnia. They may not be able to rely on their ability to sleep at night due to high toxicity levels, high levels of adrenaline, and very low levels of melatonin and serotonin. Oftentimes, they show up with cognitive problems. They're very confused, poor attention, focus, even if they're brilliant. There's a lot of very smart people that I work with who have suffered so much from protracted withdrawal that it's very hard for them to think things through with clarity. One particular patient had very high ammonia levels, of course, which can cause foggy thinking. Another problem a lot of people with protracted withdrawal have is high levels of emotional and physical and psychological trauma and neglect in their background. Almost everybody I encountered had very high levels of stress at an emotional and psychological level. It's very important for the physician to not just treat everything as a physical problem, but to also try to heal the therapeutic issues that cause blockages in energy flow. The last thing that I see a lot of in protracted withdrawal is akathisia. That's when a person can't sit still, they are very restless, they have to pace. And I believe that's because the adrenaline causes them to be in a constant state of fight or flight. And they just want to run away from, in this case, they just want to run away from their own inner discomfort, but there's nowhere to go. So the question is, can protracted withdrawal be healed? I want to be realistic about protracted withdrawal. It really depends on how long this protracted withdrawal has been allowed to go on, how profoundly compromised the body has been over that course of time, and how much of this carousel of medications that come on and off has been the long-term experience of the patient. So there's a lot of things that can cause protracted withdrawal to be somewhat limited after a prolonged period of stress and oxidative stress. So with oxidative stress, sometimes you can heal the organs and you can heal the body at the cellular level, and sometimes you can't. But you can always, I believe, ameliorate the symptoms. You can help the person restore at least some function. For example, I'm still working with someone with an inability to handle medications back when he was in college. And now he's in his 40s. But he was put on psychiatric medications for what seemed like depression. He had very poor reaction to the medications, ended up becoming psychotic. They put him on an antipsychotic. He didn't do well on that either. They took him off everything. He had horrible withdrawal symptoms. By the time I saw him, it was quite a long time since he had been taken off his medications. He was not functioning well at all. Instead of being able to go to college and take tests as he was able to do before, he was unable to really speak. His walk was very stiff, like a tin soldier. There was a sense of disconnection for him in terms of how to function and a lot of confusion. He was running away from home a lot, just out of the blue. And when I started working with him, he just wasn't able to function very well at all. The mother told me that he had become very sensitive to even supplements. In fact, one particular supplement provided to him by a functional physician had caused him to decompensate. Believe it or not, the very first intervention that he could handle was the diffusing of essential oils that were calming. By diffusing the essential oils, it helped him with oxidative stress. Another supplement that was very important for him was called Gut Support by, you can buy it at a website called intelligenceofnature.com. So gut support actually helped his GI system to work a little bit better. I've worked with him for over 10 years. We do regular energy work. He's on a set of supplements, but what we were able to restore is not everything. He is calm. He eats well. He sleeps well, but he still can't really speak very well. He still has difficulty with, at this point, autistic symptoms, and therefore he's just not able to really engage with other people. However, he doesn't run away from home. He doesn't cause any drama in the home because in all other respects, he's able to function. So for this particular patient, the protracted withdrawal resulted in lost function that was not able to be restored fully. The patient's parents have not given up. And so I continue to work to the best of my ability to help that individual. Now, there are some other individuals I've worked with protracted withdrawal. Recently, I had a patient who came here having gone through a carousel of countless medications on and off. And he had typical symptoms of cognitive confusion and poor sleep and anxiety and things like that. We did some energy work to help with genetics and infections and toxins. Now, this particular individual is a very intelligent person who is a professor. He was very open to the functional and energy paradigms. And even before we started him on any supplements, he already noticed that his symptoms were decreasing from purely the energy work. So that's very encouraging. He was sleeping every third night, and with the energy work, he's having much more a reliable sleep pattern. Another woman in her late 70s came to me with protracted withdrawal, coming off a SSRI, but she also had been on various different medications before then. And despite difficulties with plummeting health and problems with insomnia, we're starting to see that even for someone almost 80 years old who had protracted withdrawal, about 50% of her recovery is on board. And she's had about, I would say, 3 weeks of supplements and about 6 sessions of energy work. So it's also encouraging that function can improve with energy medicine, functional medicine, things can get better. And so I believe that ultimately that individual will also be able to reach her goals with regard to recovery. So can improvements occur through functional medicine and energy medicine? I would just say yes, that definitely improvements can happen. However, for some people, it might only be a 20% recovery. For other people, it might be 80%. It really depends on age, the medications that had been withdrawn, and how long the person has suffered from profound sleep deprivation and a nutritional deficiency. My goal here is not to depress you. My goal here is to encourage people to really appreciate the need for proper withdrawal from medications and also to not prolong withdrawal if they have an option to be stable on medications and find someone who can work with them properly. And that if you want treatment for protracted withdrawal, it's really important for you to integrate a clinical intervention that includes not just functional medicine, but energy medicine, because so many people with protracted withdrawal do have genetic problems, inflammation, and those underlying problems, I believe, need to be healed at the energy and information level. And I've done that in the past with good results. With that, I hope that you'll have a much better understanding of protracted withdrawal. If you do have questions about what protracted withdrawal is, I'm hoping that maybe another month or 2 months or even 6 months, I can come back and give you more information about protracted withdrawal and give you more feedback about my experiences helping those people who have suffered from withdrawal for a very long time in their lives and are looking for some kind of solution to help them. And I hope that for you, that this information will be very useful for you, that you will seek out the right people to help you with withdrawal, and that you will be able to heal from these symptoms, or that your loved ones that you know who suffer from protracted withdrawal can also heal from your guidance. I wish you all well. I hope you have a great week. Thank you very much for listening to this podcast to its end. I hope that you'll support my podcast with 5-star ratings and that you'll be able to support it in other ways through financial support to the podcast. There is a place on the podcast where you can donate to this podcast and help me with my work. All right. Thank you so much for your time, and I will be back with more information that can be helpful for your life. Thank you for listening. Bye-bye.